Today, we're going to talk about a really important medical test that's kind of like a secret messenger for one of your body's busiest organs. We're talking about the gamma-glutamyl transferase test, or, much easier to say, the GGT test. So have you ever wondered, what is your liver trying to tell you? Sometimes it sends out signals when it's in trouble, and the GGT test, it's one of the best ways we have to actually listen in. Okay, so let's get right into it. What exactly is this GGT thing? Well, it's an enzyme. And an enzyme is just a type of protein that helps make chemical reactions in your body happen faster. Now, you can find GGT in a few different places, but it mostly hangs out in your liver. That's its home base. Now, here's the cool part. You can basically think of GGT as a distress signal. See, in a healthy liver, the GGT levels in your blood are nice and low. But if your liver gets damaged, GGT starts to, leak out into your bloodstream. And by measuring how much has leaked out, doctors get a really important clue about what's going on with your liver. So that leads to a pretty obvious question. Why would your doctor want you to get this test in the first place? Well, it all starts with listening to the symptoms your body might be showing you. Your doctor might suggest a GGT test if you're feeling things that could point to liver disease. Stuff like feeling tired all the time, or jaundice. That's when your skin and eyes get that yellowish tint. Maybe losing your appetite or having pain in your belly. These are all potential warning signs. And this test is actually super useful for a few different things. It can help figure out if you have liver disease, check if your bile ducts are blocked, and even help monitor alcohol use, since that can really make GGT levels spike. But as we're about to see, one of its most powerful jobs is helping to figure out if a problem is coming from your liver or from somewhere else entirely. Okay, so maybe you need the test. What does that actually mean for you? What's involved? Well, I've got great news. It's incredibly simple. Let's walk through the procedure. Seriously, the most important thing for you to know is that this is just a quick, simple blood test with almost no risk. There's really nothing to worry about here. It's basically 3 quick steps. A nurse or technician will find a good vein in your arm, they'll use a small needle to draw a little bit of blood, and they'll collect it in a small tube. You might feel a tiny pinch, but the whole thing is usually over and done with in less than 5 minutes. That's it. So how do you get ready for it? Again, pretty straightforward. You'll definitely want to tell your provider about any medicines you're taking, and just be aware that things like drinking alcohol or smoking can mess with the results. Because of that, your doctor might ask you to hold off on those, and maybe even to fast for a little while before the test. All right, the test is over. Now comes the part we all care about, right? What do the results, what do those numbers actually mean? Let's decode them. On a basic level, it's actually pretty clear. If your GGT levels are higher than normal, it could be a sign of liver damage. And generally speaking, the higher the number, the more damage there might be. On the other hand, if your levels are low or in the normal range, it probably means you don't have liver disease. Simple as that. So what kinds of things can push those GGT levels up? Well, the list is actually pretty long. It includes things you'd expect, like hepatitis or cirrhosis and heavy alcohol use. But it can also point to things you might not expect, like problems with your pancreas, diabetes, or even heart failure. And yep, certain medicines can do it too. And this is probably the most important thing to remember about this whole test. GGT is great at showing that your liver is damaged, but it can't tell you why. Think of it like a smoke alarm. It tells you there's a problem, but it can't tell you what started the fire. So if the GGT test is just the alarm, how do doctors figure out what's really going on? Well, it turns out GGT doesn't work alone. It often teams up with a partner to solve the mystery. So how do they narrow it down? Often, the answer comes from comparing the GGT test with another enzyme test, one called alkaline phosphatase, or ALP for short. And this is where it gets really clever. Check this out. If both your GTT and your ALP levels are high, then boom, the problem is very likely in your liver. And this is the key. If your ALP is high but your GTT is totally normal, that tells your doctor to look somewhere else. It suggests the problem is more likely a bone disorder, not a liver one. And isn't that brilliant? Just by comparing these 2 little numbers, your doctor gets a massive clue about whether they should be focusing on your liver or on your bones. It's like a diagnostic shortcut. So, at the end of the day, if you take one thing away from all of this, let it be this. The GGT test is a vital clue, but it is not the full story. It's that sensitive distress signal from your liver that gets the whole investigation started. So that leaves us with one final thought for you. A GGT test isn't just a number on a page, it's the beginning of a conversation. Knowing that this test is the smoke detector for your liver, what's the first question you'll ask your doctor to help them find the source of that smoke?